A shocking revelation: OCD cases are skyrocketing among the youth, leaving families devastated and the healthcare system struggling to keep up. But is it a crisis or a wake-up call for change? The BBC has uncovered a startling trend in England's mental health landscape. In just a decade, the number of 16 to 24-year-olds reporting symptoms of obsessive-compulsive disorder, OCD, has more than tripled. This surge has propelled OCD to the second most prevalent mental health disorder among young adults, according to a major NHS England survey. OCD is like a relentless bully, shares Sophie Ashcroft, a 22-year-old who has been grappling with the condition. It attacks everything you hold dear. Contrary to the common misconception of OCD being solely about cleanliness and order, Sophie emphasizes that it's much more complex and debilitating. The BBC's Your Voice, Your BBC News initiative has received numerous pleas from young people and their families, desperate for NHS treatment. Those fortunate enough to access care often encounter a shortage of specialists and effective treatments. The average wait time for young people to receive treatment at a national OCD centre in London has soared to 41 weeks, a stark contrast to the 15-week wait just 5 years ago. The government, while acknowledging the challenges, claims to be addressing the issue. They cite the hiring of 8,500 additional mental health workers, increased access to talking therapies, and improved support through the NHS app. Moreover, they plan to expand mental health support teams in schools. Sophie's daily life is a testament to the struggle. She often finds herself trapped in her home, compelled to repeat simple tasks like showering or brushing her teeth to combat distressing thoughts. "A single bad thought can ruin my entire day," she confesses. The BBC has heard heart-wrenching stories from families whose lives have been upended by OCD. Some have spent hundreds of thousands of pounds on private care, unable to secure NHS support. Charities are adamant that this is an OCD crisis, demanding the government take immediate action. OCD can affect both adults and children, with symptoms sometimes emerging as early as 6 years old. However, it often intensifies during puberty and early adulthood. Sophie's symptoms first appeared at age 9, but a tragic loss of a close friend a decade later exacerbated her condition, leading to a cycle of repetitive actions to cope with intrusive thoughts. Despite her struggles, Sophie has managed to complete drama school, hiding her OCD from the world. "I'm good at concealing it, but behind closed doors, it's sheer panic," she reveals. The latest NHS Adult Psychiatric Morbidity Survey, June 2025, reveals that approximately 370,000 young people in England reported OCD symptoms in the 2023-24 financial year. This figure is more than triple the number from 2014, highlighting the urgency of the situation. OCD now ranks second among named mental health disorders, surpassing depression. Generalized anxiety disorder, GAD 7.6%. Obsessive-compulsive disorder, OCD 5.7%. Phobias, 4.8%. Depressive episodes, 3.8%. But what's driving this alarming rise in OCD among young people? Experts suggest that increased awareness has encouraged more individuals to seek help. However, charities and those living with OCD point to societal pressures and the influence of social media as the primary culprits. Lee Walbank, CEO of OCD Action, describes young people's lives as a pressure pot. Financial, educational, and global issues create a stressful environment, with social media adding fuel to the fire. Minesh Patel, from the charity Mind, also highlights the impact of the COVID-19 pandemic, which disrupted routines and intensified hygiene-related anxieties. NHS treatment for OCD includes specialized cognitive behavioral therapy, CBT, which may involve exposure and response prevention, ERP. ERP helps patients manage anxiety by gradually exposing them to their fears while preventing compulsive behaviors. Antidepressant medication is also commonly prescribed. However, access to these treatments is not guaranteed. Sophie, for instance, has been waiting for 2 years for a specialist appointment after her GP suspected OCD. Her limited course of CBT is ending soon, leaving her terrified of a potential relapse. Lee Wellbank criticizes the government's lack of regular data collection on OCD, hindering the NHS's ability to understand the disorder's true impact and treatment outcomes. Without this data, the charity argues, the NHS is blind to the real extent of the problem. The BBC's inquiries in Scotland, Wales, and Northern Ireland revealed that these regions do not collect data on young people with OCD symptoms, further complicating the understanding of the issue. One mother from southern England shared her daughter's harrowing journey with OCD. Her daughter, now 17, first exhibited signs at age 10, and her condition has since worsened. The mother describes her daughter's decline from a scholarship-winning student to being sectioned multiple times. Despite some specialist treatment, her daughter's illness often prevents her from leaving home for appointments or taking medication. Our lives have been devastated, not just by the illness but by a system that failed to provide the necessary help, the mother laments. She believes the UK is falling short in treating severe OCD cases, citing a lack of specialists, beds, and treatment options. The Maudsley Hospital in London offers treatment for children and adolescents with OCD. However, wait times have increased significantly, from 15 weeks in 2020 to 41 weeks in 2024. The hospital trust assures that they are working to reduce these delays, aiming for an average wait of 12 to 16 weeks by early 2026. Even when help is available, it may not be enough. Graham and Marie Fuller, from Norwich, shared their daughter's experience with OCD, which led them to seek a radical procedure in Texas. Their daughter underwent deep brain stimulation, DBS, surgery, a treatment approved in the US but not in the UK for OCD due to insufficient evidence. Marie reveals that her daughter had considered ending her life in Switzerland before the surgery. Now, she is back at university, but the family remains cautious about the long-term success of the treatment. The UK's health guidelines for OCD are 2 decades old and are currently under review. There is a consensus that these guidelines need to incorporate new technologies and potential drugs. However, Lee Wellbank emphasizes that improved funding is crucial to ensure young people receive the support they desperately need. The Department of Health and Social Care acknowledges the challenges, blaming a neglected NHS system inherited by the current government. They promise an additional £688 million in funding for mental health services. Yet, young people like Sophie remain fearful of the future, as the limited support they receive may not be enough to keep their symptoms at bay. As the debate rages on, one question remains: is the system doing enough to address this growing mental health crisis, or is it time for a radical overhaul?